Good evening to all. I welcome you all to the exclusive Kidney Care Show, an initiative by Integrated Health and Wellbeing Council powered by JB Chemicals and Pharmaceuticals. I'm Ridhi Lakra, Assistant Editor, IHW.TV. And in this live session, we will be discussing about preventive lifestyle for kidney health. According to the stats depicted in International Society for Nephrology in the year 2022, chronic kidney diseases affect 1 in every 10 million people. It is estimated to be the fifth most cause of death by the year 2040. India has a huge kidney disease burden with the 17% of population having chronic kidney disease and an estimate new 5 lakh people reach dialysis stage every year. No country can afford this burden, and the only way to address this issue is to create and increase the awareness about the kidney disease in the community. Hence, the aim of the talk show is to impart guidance on preventive lifestyles on kidney health, for which we have with us Dr. Garima Aggarwal. Dr. Garima is a consultant nephrologist and transplant specialist at the Manipal Hospitals, Bangalore, and she is an expert when it comes to kidney health. We welcome you to the show, Doctor.
Hi, thanks a lot, Rudy. Happy to be here.
Doctor, when my very first question would be a very simple, basic one. When we talk about our lifestyle, over the years, there is a huge change in our lifestyle. We have started having a lot of our sedentary lifestyle because of the COVID. Then we are into a lot of eating habits. Then with the globalization, we enjoy a lot of other foods from the other countries, experimenting. So, how do you think, like, how does our lifestyle has affected our kidneys over the years?
Oh, I mean, certainly so. There's one thing that, of course, people say that, it's also the detection is more. People were not aware about kidney disease. So that's one issue that is adding on to the burden of kidney disease. But when you say lifestyle, I think there is no surprise. I think everybody knows now that India is the diabetic capital of the world, soon to be the hypertensive capital of the world. And these are new statistics. These are happening because of more sedentary lifestyle, more fast food, more salt, because fast food and all this, what you said, like various kinds of exotic foods usually are heavy in salts, and all of these are contributing to a heavy burden of diabetes and hypertension. If you ask me, when I see my dialysis unit, 80% of these patients are on dialysis now with kidney failure because of diabetes and hypertension. So 80% almost of our patient burden is contributed by diabetes and hypertension. And diabetes and hypertension is happening because of this bad lifestyle. So it's all very interrelated. My advice to my patients is no different from the cardiologist's advice or the endocrinologist's advice. You have to cut down on this extra salt, extra packaged foods. Another thing we do when you talk about lifestyle is we're all on the move. We are very ready to eat this frozen, ready to eat food. You have to understand, ready to eat food is made with preserved with sodium, and that's increasing your sodium and chemical intake, and that's really bad for you too. And ordering in, I'm from Bangalore, it's also the capital of ordering. I heard from a Swiggy friend of mine that Bangalore is the capital of ordering out. It's not a good statistic to have, which is why my OPD has younger people now coming in with hypertension, obesity, all of those things. So it's all very interlinked. And
Yes, Dr. Karima. We'll discuss about this very fad about the food which has been brought to our culture. But before discussing that, I want to ask another question related to the kidney itself. Like when we talk about the kidney failure or maybe the kidney diseases, what are some of the early symptoms when we see, like one, as you said, if somebody is having diabetes and hypertension, that is leading to kidney failure or kidney, any form of a kidney diseases. So, what are the early symptoms? What we see?
very good question, Riddhi. Actually, this is something I keep telling people, and patients come to us and regret, is that early kidney disease has no symptoms. So, by the time the symptoms start developing, by the time 70% of both your kidneys are already damaged, which is why we stress on the importance of talks like these, keeping your kidneys healthy, preventive health, and checkups. The only very early signs that patients sometimes notice are like frothing or soap like bubbles in your urine more than ordinary. Some patients describe the entire urine is covered with a lot of bubbles. So, frothing of urine is an early sign. Another early sign is a high blood pressure. So suddenly young person detected with a high blood pressure, a person who was already a hypertensive suddenly started having more increase in their blood pressure than usual. So that those are the early signs. When the kidney disease is a bit more advanced, some of the features that the patients come with are swelling of their feet or around their eyes. They describe that when they walk or do some exertion, they feel breathless. Some of them describe this kind of chest congestion and breathlessness on lying down. Nausea and vomiting is very typical of kidney disease. Patients of mine describe weeks and weeks of not being able to eat, complete loss of appetite, feeling very nauseous when looking at food. Patients have weakness or fatigue, and this is because kidney is responsible for making hemoglobin in the blood, and so they have a low hemoglobin. I get a lot of patients who have been diagnosed with low hemoglobin, given blood, and never been checked for kidney functions. So low hemoglobin, feeling very weak, feeling very drained out are symptoms of kidney disease. Some patients also have itching or skin changes, like mostly like a lot of itching around their body. So these are some of the more and decrease in urine output of very advanced kidney diseases. They say, doctor, I'm not passing enough urine, or I'm going frequently at night. So these are some of the common symptoms of advanced kidney disease.
Dr. Garima, do you also see when you were in the beginning, you were telling about the children, the younger children having kidney problems. So, do you see them at a very younger stage, or is it like you're telling in the age of 18, 20, or the teenagers also?
So the causes for kidney disease in children are different from the causes of kidney disease in adults, because adults it's also compounded by lifestyle and all that. But there are genetic diseases which cause kidney diseases in children, and these some of them are detected as early as during when they are in the mother's tummy, like intrauterine scans, ultrasounds are done. Patient mothers are told to get anomaly scan and all that. Even they can pick up a child's kidney issues. So these genetic kidney diseases are detected very early in the life. And typical features are children having, urination, more urination at night. Mothers say, ye to bed wetting, there's a lot of bed wetting, or they're having frequent infections. Children shouldn't be having UTIs. If they are having frequent urinary infections, those are the symptoms for children. And then the adults, of course, are what I just described to you. So the incidence is a lot more in adults than in children, but to pick up the signs in children and diagnose it is becomes more difficult. Which is why children come to us advanced, because they have seen a local doctor, or the patients have just or parents have just ignored these symptoms, and so that's a problem.
So, Dr. Garima, like which category of people are at the higher risk of getting a chronic, developing a chronic kidney diseases? So, is there a particular age group, or in terms of the risk factors when you talk about?
Absolutely. I mean, the age group is it's getting younger. When I was doing my training, we were told, above 50, but I have to tell you now it's above 40s. Anybody who's a diabetic, anybody who has hypertension, anybody who's a younger person diagnosed with hypertension, 95% of the times, young people having hypertension is because of kidney disease and not the other way around. So that's something. People who are obese, obesity is a very big risk factor for kidney disease. People who have family history of kidney diseases, there are kidney diseases which run in families. So family history of kidney diseases, so these are the people who are at highest risk. Another group of patients who are at high risk are people who have had a kidney injury in the past. Like there'll be people who come to me and say, oh, 5 years ago I took some antibiotic, my kidney function was derailed, but after that doctor told me it's okay. But if you have had a kidney injury in the past, you are more at risk of developing CKD in the future. So you should always be getting regular checks done. And the most ignored group is mothers during pregnancy who develop high blood pressure or blood sugar in their last, you would have heard in the last 3 months, mothers get protein leakage, swelling of their feet, high blood pressure. These ladies are also more prone to develop kidney disease in the future. So that's something they forget. They come to me and, yeah, I had hypertension at the time of pregnancy, but after I delivered, doctor said it's all okay. But they never again bothered to check their blood pressure and never again bothered to check their kidney function. So these are the more classes of drugs people who are more at risk.
Dr. Karima, when we talk about the lifestyle disorders, like that may result for kidney failure, when we talk about in terms of the alcohol, so how directly alcohol impacts a kidney failure in the future?
Absolutely. So, alcohol, it doesn't have a direct impact on kidney function, but alcohol has an indirect impact on kidney function because alcoholics are very prone to high blood pressure. Also, alcohol doesn't come alone. It comes with high salty snacks, a bad diet, also very low water intake. These people are usually more dehydrated. So, in these indirect ways, high salt, dehydration, high blood pressure are going to affect your kidney. When you talk about vices, I must tell you that smoking, I know we see on the packs and in the theater those pictures of bad cancers, but people should know that smoking is a direct risk factor for kidney disease. If you're a smoker, your chances of getting kidney failure are 30 to 40% higher than a non-smoker. So smoking is something which directly affects the kidney. Alcohol is something which affects the kidney largely through indirect ways but has an impact.
So as it implies for the smoking as well, like if not alcohol.
Yeah, smoking actually, just not indirectly. Smoking, tobacco, nicotine are known to be direct toxins to the kidney. As we know, see, kidney is the ultimate filter of your blood. It is in size only 0.1%, but it receives 25% of your blood supply every minute. So all of your blood's toxins are getting concentrated in the kidney, and nicotine and tobacco are directly toxic to the kidney. So the first advice we give for anybody who's been found to have marginal kidney function or CKD, we say stop smoking if you want to save your kidneys in the future. So this is my advice to people who don't have kidney dysfunction. Stop smoking. You can protect your kidneys in the future.
Dr. Garima, you were talking about like when somebody is having an alcohol, they also have this habit of having a lot of junks along with it. So is there the excessive salt is a very important thing what people like avoid it, and they have a habit of eating a lot of excessive salt. So when we talk about in general also excessive salt, how would you describe that? And in terms of a regulation or a moderation of the salt intake, so how would you define that in terms of the processed food and the regular consumption in the normal food?
That's such a good question because our knowledge of salt intake that we are taking is so poor. We think salt means just the salt you add. I mean, today I had a lady in the outpatient clinic and I was telling her, you have to decrease your salt intake. And she told me, no, no, doctor, I don't take any salt. And then she goes on to say that she can't eat food without pickles. So she's eating pickles 3 times a day and she's telling me she's not taking salt. So please understand, salt doesn't come just that white salt that you see. Salt is in the form of baked goods because they are baking soda, which is a form of sodium. All everything that is ready to eat or pre-cooked or preserved is preserved with sodium. Pickles, sauces are a very high source of sodium. So it is seen beyond doubt that populations who have high salt intake, you just talked about western influence and western populations, so these populations which have a high salt intake in general are known to have more hypertension and more kidney failure, as opposed to populations like populations in the Middle East. Their general diet, the Middle Eastern diet, is very low in salt, and they are known to have less incidence of kidney disease and hypertension and other such complications. So yeah, so that is one thing that is beyond doubt, that high salt intake is bad for you, for everybody. You don't need to wait to get a disease to stop your salt intake. Number two, be conscious, like pickles, sauces. Read labels. When you read labels, you find out that okay, this has so much sodium content, so that's something we have to be aware of. I hope that in the future our FCCI and our food governing authorities are more conscious, and kidney groups are pushing that anything which is high salt should be labeled in the front of the pack as it is high salt, so you can know that what you're putting inside your body. So take healthy snacks, take just like hummus and like maybe some carrots instead of having fried and salty snacks. Those are some of the tips I give my patients. Yeah, so
no, Doctor, we also see a very like a new trend. You cannot say new trend; it is already there. A lot of people consume tea, a lot of tea, and the younger generation have this habit of having excessive coffee consumption. So, is that also somewhere related to our kidney and our kidney functions as well?
a very good question. So, tea and coffee in moderation, like 1 or 2 cups of tea, or up to 2 to 3 cups of coffee, are okay for you. And in fact, coffee has some antioxidant and heart healthy properties as well. However, anything in excess is bad. So, a lot of the green teas are actually just concoctions of bunch of spices, and we don't know the content of them. And I know people who are taking 5, 5, 6 cups of green tea, thinking it's some kind of diet food, and that's not good good for you. Those spices contain high amount of oxalate, and this oxalate can damage your kidneys. So everything in moderation is okay, but an excess of anything is bad for you. Similarly for coffee, coffee is known that it has some harmful chemicals, and if you exceed up more than 3 cups a day, you might be exposed to those, exposing your kidneys to those harmful chemicals. So I'm not, I'm a coffee drinker. I'm not saying don't drink it. I'm saying everything in moderation is good. Don't go for extreme of anything, just for diet, for tea, for coffee, for everything.
Thank you, Doctor, for explaining that. Dr. Garima, you were also talking about the excessive of consumption of like the herbal products, like in form of a tea as well. But there is an other side to it that a lot of people have this herbal products to maybe to reduce weight or maybe to like treat the other diseases of their body. But gradually, it can also lead to kidney problems. Like in a simpler way, if you could explain what exactly happens in such cases. And a lot of people also have a habit of taking over the counter antibiotics or any sort of other drugs as well. So how does this affect on a longer run to our kidneys?
Absolutely. So I think we can divide this into three groups. One is the herbal. When I say herbal, a lot of people say, no, no, but doctor, we made it in our house. See, things like seeds. We have a habit of taking a lot of seeds. And seeds are not meant for you to be eaten in those quantities. Human nature never made seeds to be eaten by humans in those quantities. If you start taking a large amount of seeds, which are not supposed to be eaten like that, you're going to have, these seeds are high in certain chemicals, like I just mentioned, oxalate and certain others, which can actually cause damage to the kidneys. I've had a patient who started taking, instead of teaspoons, tablespoons of methi, ajwain, and multiple seeds, and landed up to us with kidney failure. So one is things you prepare at home. You should know what you're taking and how much quantity of it is safe for you, and don't overdo it. That is for things you prepare at home, and it's good, you should know what is the content of it, so you can look up, okay, these things are safe for me or not. Second comes herbal products. Now in India, unfortunately, Didi, we don't have enough governance on these kind of things. Everything, anything is labeled as herbal, and in our psyche of the Indian population, it is herbal means safe. That's not always true, because if you tell me exactly what is the sodium, what is the chemical content of this, and you have done a trial and shown that this is safe for patients, I will agree with you. But unfortunately, most of these herbal products don't have such data. And what we see is people take these things who already have borderline kidney function, and a lot of them have heavy metals, a lot of them have steroids, and these can harm the kidneys. Number three is things like protein powders. People going to the gym, they take protein powders, creatinine supplements. These whey proteins are also added on sometimes with androgen steroids, because the whole point is you're taking the protein powder, you should get bulky. Your gym trainer wants you to get bulky. But our kidney is made to only take a certain protein load of our body. First of all, when you exceed that protein load on your kidney, you're overworking your kidney. And especially if you are a risk factor, like you're obese or you have some of those risk factors, you might lead to kidney damage because of that. A lot of these protein powders which are available in the market are directly toxic to the kidney because of the constituents. So I always advise my young people who come to me, please don't take anything, take something healthy, know the source of it. It should, if it's vegan, even better, a protein source rather than a whey protein source where you don't know what is mixed in it. So that's for these supplements. Don't overdo these supplements, they are toxic to the kidney. And then the last is the over the counter medications. The most common over the counter medications in our country are painkillers and antibiotic, both of which, about 90% of the painkillers which are available over the counter are harmful to your kidneys, and about 50% of the antibiotics. And we don't even ask a doctor, we ask our neighbor. उसने लिया था, उस टाइम दिया था, हमने भी खा लिया, वो डॉक्टर अभी किडनी क्रिएटिनिन क्यों बढ़ गया? I'm sorry, this is what I hear all the time. So please, if be conscious of what you're taking. Again, if you have a pain and you took one pill, it's fine. You're popping 3 pills a day for weeks because you have knee pain or you have some kind of arthritis. That's not good for your kidneys and otherwise your health. So especially people who have borderline kidney function at risk or a CKD, don't take over the counter medication. Always consult your doctor. Ask them if these are safe for you. And don't overdo any of these pills. Always better to ask a doctor whether they are safe for you or not.
Thank you, Dr. Garima, for explaining that. I hope a lot of listeners who are listening to us would actually understand the very importance of not consuming like the over counter drugs, and you explain about the health supplements as well, the whey
Food
protein and all.
supplements,
What
yeah,
we will.
Riddhi, they are so common. Guys go to the gym, they're taking three times, 2.5 to 3 times of their body weight of protein. Your kidneys are not evolved to do that, and you're just going to end up damaging them. And people should understand once the damage is done, usually we can't do much. So it's better to be safe than sorry.
Yes. So, doctor, when we talk about like the healthy lifestyle, so what can we do to avoid kidney diseases?
Absolutely. That's something I want everyone to follow. These are very, very simple rules. Number one, keep fit and healthy. Like be on the move, exercise every day. Exercise is not for weight loss. Exercise is good for your heart, good for your brain, good for your mental health, good for your kidneys. It keeps your blood flow good. So exercise every day, irrespective of weight. Number two, lose weight. There is something known as a body mass index, which is a ratio made from your weight and from your height. Everyone should be in this body mass index of up to 25. If you're above 25 body mass index, that means you're overweight for your height. And to calculate your body mass index, if you're in the overweight or obese category, please lose weight, because increased weight is, I'm all for body positivity, but if you're healthy. So if your body mass index is more, you should be trying to lose weight and cut down the pressure on your organs, especially your heart and your kidneys. Number three, eat healthy. And my one thing, if I want people to take away, is don't go for fat diets, keto. So many of these other fat diets that patients come to me with are bad for your kidneys. Take a wholesome general diet, a diet good, a small portion of carbs, proteins, fats, grains, dairy, everything in small portions, nothing in excess. So do that. So take a healthy diet, low salt intake, increase water intake. Water is everyone should be well hydrated. For an average person, it's very difficult to calculate, but I would say about 2.5 to 3, or 3.5, based on like your height and sex, is what is your average water intake. So everyone should be taking somewhere between 2.5 to 3.5 liters of water a day, adults. And based on if you're in a heat or you work out more, you should be increasing that. So stay hydrated. Do not smoke. Do not take over the counter pills. And if you have any of the risk factors that I discussed, please consult a specialist. Control your blood pressure. Like this whole concept of, the one thing that I keep telling, there's no such thing as my body is used to 160 by 100 blood pressure. There is no such thing. 160 by 100 blood pressure is damaging your body. So a normal range is made in a way that this normal range of blood pressure is not going to be harmful for your organs. So everyone should be in that normal range. So if your blood pressure is high, take help, take the right medications, control your blood sugars. If you're a diabetic, don't be like, oh well, my sugar is always like this. In the long term, this is going to harm all your organs, especially your kidneys. So control your blood sugars. I think those are the tips. If you know
Dr. Garima, you were talking about exercising. So, are there any studies that actually tell that it is good for our kidney disease or kidney health? Is there any specific studies to describe that?
Absolutely, absolutely. So I always quote these studies. There is data to show, number one, that exercise in hypertensives can reduce the blood pressure by as much as 5 to 10 millimeters of mercury. Yoga directly reduces blood pressure by 5 millimeters of mercury, and all forms of cardiac exercise up to 10 millimeters of mercury. There are exercises to show that CKD patients who exercise versus CKD patients, CKD is chronic kidney disease patients who don't exercise, the exercisers do better in the long term. The kidney failure is much later for them, and their kidney health is better. So even sugar control, people who exercise seem to have a lower HbA1c, even though they follow the same diet and same medications as people who don't exercise. So exercise on our health has such long term good effects that I cannot stress enough the importance of it.
Dr. Garima, this is one of the very important question. Like, when should like one get tested for their kidneys? And is there something a serious like a trigger? I mean, a symptom what we are seeing, or maybe we should get tested on a very short regular notice, say 6 months, or maybe in three months we should do it. And when we should go to a nephrologist to see our kidneys?
So I feel that based on everything I see in my practice in the current day, if you're a diabetic, if you're a hypertensive, if you're anybody above the age of 30 years, at least once your kidney functions should have already been checked. Okay. Other than that, if you have noticed any of the symptoms that I just described, please get your kidney functions checked. If you have a family history of kidney disease, please get your kidney functions checked. If you already have kidney disease and you were diagnosed as having borderline kidney function, ideally every 3 to 6 months your kidney function should be checked, and more than that your doctor will advise you based on your kidney level how frequently you should be getting them checked. If you have suddenly gone on a random like diet, a new diet, a fat diet, or some kind of excessive workout, we get athletes who go in, who plan their whole thing that the next month I'll be doing like this. If you're going to go for anything like that, which is going to be very different from your usual routine in terms of exercise and food, I think you should first get your blood workup done. Make sure that you are okay to follow these things. So yeah, so these people should have already been checked. And as for diabetics and hypertensives, we advise them every 6 months to get their kidney functions checked because they are very at high risk. Smokers.
And in case of like a CKD patient, if somebody is already a CKD patient, how can they prevent the further damage to the kidneys? So are there ways and tricks that they should follow on their day to day works?
Absolutely. I think the rules are pretty much the same, except the things are like we stress more on the blood pressure should be much better controlled. Their diet in CKD is very different from a diet for a normal person. So so they must consult a clinical nutritionist or a dietitian, get a good diet plan for themselves, and keep a regular checkup. In countries abroad, when the blood tests come abnormal, the dietitian calls and tells, "Oh, are you eating these things? Why are your blood tests abnormal?" Unfortunately, we don't have such a good system. We aim to have that. So if you're a kidney patient, please focus on your diet well, pressure control, sugar control, getting your regular checkups as advised by your doctor. I always tell all my CKD patients, if you go to any doctor, eye doctor, dental doctor, GP, for anything, always tell them you're CKD before you take any pill into your body. Don't go for any supplements without consulting with your nephrologist, whether it's Ayurvedic, herbal, or whatever. Anything you think is simple enough can be harmful. So those are some of the extra things that they have to be careful about.
Dr. Garima, my very last question, and I think we come to an end to this. So, can a positive lifestyle changes and adaptation to healthy habits reverse a kidney disease, and also on a longer run can help our kidneys? I mean, it can be healthy.
No, I mean, if you're detected early, then even all these lifestyle changes definitely have a positive impact on kidney disease. I'm always surprised by my patients who I thought have bad kidney function and they improve with lifestyle changes. However, kidney disease, this should be in a consultation with your nephrologist. I don't want to give out the wrong impression that, oh, you have kidney disease, you take lifestyle changes and you'll be fine. It should be both lifestyle as well as drugs, and we know that all the drugs and all the treatment works better if the lifestyle changes are accompanying it. So yeah, with lifestyle you can maintain your kidney functions in to some extent. In early stages you can reverse your kidney dysfunction as well. And prevention, certainly, the I mean, like, if you follow these lifestyle changes, you can certainly prevent kidney disease and all kinds of diseases in the future. And I think as we are older, we should be more conscious of our health. We should be more conscious of what we are putting into our body and how it affects us. I think a more evolved country, as we are becoming, we are no more a lower middle income country, we're a higher middle income country. And so as we are evolving, educating ourselves about so many other things, we should also educate ourselves about our body.
Yes, Dr. Garima, thank you so much for that. And we really had a very good discussion about healthy kidney and how we can prevent kidney diseases in the future by having a very good lifestyle. So, thank you, Dr. Garima, for joining us today. On behalf of the ISW Council, I would like to thank you, and also JB Chemicals for doing such an initiative on kidney healthcare. And I hope our listeners who are listening to us would understand the importance of their health and also their kidneys. Thank you so much again. Have a
Thank
good
you so
evening.
much, Riddhi. Thank you. Thank you. Have a good day. And thank you for having me. It was such a good discussion. And I hope even if we get to 5 people, we have made a difference, you know. Yeah.
Yes, doctor. Thank you so much. Have a good evening.
You too. Bye.